Welcome to Valley Regional Hospital. I'm your host, Elizabeth D'Orazio, and I'm joined by the Chief Nursing Officer. Now, I don't know about you, but if you've ever been to a hospital, or you have family or friends that work in hospitals, you know the nurses are the lifeblood of the hospital and they're the backbone of anything that happens. So Lynn Gagnon is really, you are the driving force and you help make sure that all the wheels are going in the right direction. So Lynn, thank you for joining us and taking time out of your busy day to tell us more about Valley Regional. And one of the things I understand that you do in addition to coordinating the nursing is you're in charge of safety measures here in the hospital. Tell us more about the safety measures here that have been working.
Well, patient safety is paramount in all the services that we provide here at Valley, as it is in all hospitals. Small community hospitals are challenged to meet the same level of expectation of patient safety that your large tertiary care hospitals are, but oftentimes you don't have the resources that the larger hospitals do. So it's important that everybody, all of the nursing staff, all of the clinical staff, understand the importance of patient safety.
And that's one thing, it's not just a matter of tripping over something. We're dealing with, we've heard of superbugs or ongoing infections and things like that. So really, there's got to be a high level of cleanliness and accountability in a hospital to maintain very good standards.
Absolutely. We have many standards that are set for us, and it's important that we know those standards, adhere to them. Many of them we now are mandated to report out on, and we report to the National Safety Infection folks through CDC.
Right.
And we report any kind of infection or exposure that way. We also have safety measures as relate to protecting patients from themselves, reducing risk and harm to themselves. And also to our employees, and we have a responsibility to keep our employees safe as well.
It's true. That's true. It goes both ways.
It does.
And speaking of employees, the nurses here are top-notch.
Absolutely.
So one of the things we know in the community is Valley Regional is known for a well-trained nursing staff, probably due in part to your efforts. Tell us a little bit more about the nursing here and what it's like to be a nurse here and serve the community.
I think the nurses you find in community hospitals have a different passion than those who go in the larger tertiary care facilities. They're very community focused. You'll find many of the nurses know the patients they're caring for, know their families, so that brings an even different level of commitment to the patient experience that you sometimes gets lost in the big environment where there's so many residents, interns, all of those who are wanting to learn. In a smaller hospital, you've got a very committed, community-focused nursing staff. And
you have to be able to do a wide range of things.
Yes, definitely.
That's one thing. I have family who are nurses, and they said, their experience in the smaller hospitals really was the most learning they had, because you had to be ready for anything, because you couldn't just say, oh, there's somebody else that does that.
Correct.
It's you, and you got to learn. But also the level of communication between doctors and nurses is key in community hospitals. And speaking to many of the staff members here, it sounds like there's a wonderful rapport between nurses and the doctor staff.
Definitely. An open communication opportunity because they do work so closely together. Nurses can go to another area to help. If the med-surg nurse and there's a crisis in the emergency department, they may not be trained in the emergency department focus, but they know the community, they know the environment. They can always go there to help and assist, and the reverse is true. If something's happening on the med-surg floor, the emergency nurses are more than willing to jump in and go help. And we've had even on occasion some of our OR nurses, when we've had some downtime in the operating area, they will go over and help in the oncology clinic. So you really have to expand on the resources you have and help nurses maintain those skills.
And that's all part of the ongoing commitment to quality care here at Valley Regional, including, this wonderful relationship with Dartmouth-Hitchcock to bring in more specialists in a local setting.
Yes. Yes. I think it's helpful for when you look at the relationship, particularly for our specialist physicians, knowing that there's a limitation of the critical level of care that you can provide in a community hospital, but knowing that you can care for those patients in their community, but then have the resource to send them to a larger facility that can take the more complicated, more critical level of care is very helpful for those physicians in maintaining a commitment to the community, but also maintaining their own skill set by being able to go to a larger facility and
couldn't have
take
said
care
it
of them.
better. That's the exact reason Valley Regional is here. We want to thank you for your many years of service to the community here.
Thank you.
And we want to make sure that you know that Valley Regional Hospital is here for you.